Welcome to the presentation of the Healthwatch Lincolnshire Annual Report for our 2023 to 2024 year, The Value of Listening. Hello, we are HW Links, and HW Links is a people-first charity dedicated to improving well-being and influencing change. We provide engagement to insight, gathering people's opinions and experiences to provide independent understanding. HW Links are proud to deliver the Healthwatch Lincolnshire contract. Healthwatch Lincolnshire is your local health and social care champion, and the public is at the heart of what we do. We make sure NHS leaders and decision makers hear your voice and use your feedback to improve care. We are also here to help you find reliable and trustworthy information and advice. Here are some of our highlights from the 2023 to 2024 year. Services can't make improvements without hearing your views. That's why over the last year we have made listening to feedback from all areas of the community a priority. In doing so, we have had 2,328 people share their experiences of health and social care services with us, helping to raise awareness of issues and improve care. Our work on menstrual and menopausal health has contributed to the Lincolnshire Women's Health Strategy and Health Hubs, recommending quicker diagnostic testing, better training for healthcare professionals, and more emotional support for service users. Our data collection on GP referrals uncovered challenges with delays impacting health and well-being. Healthwatch England have highlighted this to decision makers, calling for improved efficiency in the referral process. With maternal mental health, we gathered insights from women experiencing mental health challenges during and after pregnancy. This work contributed to updated guidance for GPs on 6-week postnatal checks, ensuring that mental health is prioritised in postnatal care. We continued advocating for better access to NHS dental care, and by sharing patient experiences, we've highlighted long waiting times and the difficulties. The NHS announced changes to their contracts with dentists after our data showed widening inequalities. We helped address critical vaccination gaps, ensuring that vulnerable and housebound individuals receive their COVID booster vaccines. We strengthened our outreach efforts to ensure voices from underrepresented groups, including those with sensory impairments and learning difficulties, were heard and that their needs were met. We have also seen an impact digitally, with our website seeing over 30,000 page views, and we have reached over 300,000 people on social media. Finding the right help and support can be worrying or stressful, but there are a number of organisations and community groups who can provide this. But people just don't know where to look. Last year, our information and signposting team helped 4,555 people who came to us for clear advice and information about topics such as mental health and the cost of living crisis. This year we've helped people by providing up-to-date information, including 30 new information and advice articles on our website. Examples include things around what support can I get as a carer, essential first aid kit suppliers for every home, what to expect after the dementia diagnosis, and what is measles and who can get the vaccine. You can come to us for signposting and information in a number of ways, including over the phone, use our feedback form, raise your comments with our volunteers in the community, through our website, emails, letter, or face-to-face in person. Our Your Voice at Healthwatch information events have continued to grow in popularity. These events are free to attend for the public in Lincolnshire, and they're here to listen, learn and discuss specific health and care services. Holding 2 very successful public events with a variety of themes, we have included health and care leaders and encouraged audience participation through presentations, Q&A sessions and a marketplace full of local support services and organisations. Local Healthwatch have a statutory function to enter and view on a service. which is carried out by staff and trained volunteers in a professional manner. An enter and view visit is not an inspection, but rather its purpose is to observe the nature and quality of a service by speaking to people who use it and the staff that work there. We then report our findings and recommendations to the provider, local authority, Healthwatch England and other statutory bodies as required. And over the last year we've conducted 14 enter and view visits to various health and care services, including care homes, urgent treatment centres and mental health units. These visits focused on accessing the quality of services and engaging with residents and staff to gather valuable feedback. One notable visit was to Glebe House in April, where concerns about the quality of food were raised. Following this, positive changes were implemented after the adult social care team addressed the issues. Another significant visit was to Maple Lodge Mental Health Rehabilitation Unit in May, where Healthwatch's recommendations led to the introduction of daily activity programs and increased community engagement for service users. Additionally, mystery shop visits to 6 urgent treatment centres in Lincolnshire identified issues with accessing appointments and communication with NHS 111, which led to improvements in service delivery and patient interactions. These visits played a crucial role in highlighting areas for improvement and ensuring that patient voices were heard, resulting in enhanced care across the county. Now, we're supported by a team of amazing volunteers who are at the heart of what we do. Thanks to their efforts in the community, we are able to understand what is working and what needs improving. We're lucky to have 36 outstanding volunteers who gave up 1,669 hours to make care better for our community, and they've supported us by visiting community events to promote Lincolnshire Healthwatch, collected experiences and supported our communities to share their views with us. They've carried out enter and view visits to local services to improve them. They've visited many warm hubs as a targeted area to get a better understanding of their vital role in our community. We say thank you to all of our volunteers. Here's what Charlie had to say about volunteering.
I am new to Healthwatch, having only joined very recently. It's amazing to be part of something that aims to gather feedback from the residents of Lincolnshire and to make a difference. I want to gain experience for my future career in health and do something for my community. Learning about the NHS and social care is interesting, and I hope in some small way that by volunteering with Healthwatch, I can help improve things.
In over 10 years since Healthwatch was launched, we've demonstrated the power of public feedback in helping the health and care system understand what is working, spot issues, and think about how things could be better in the future. Services are currently facing unprecedented challenges, and tackling the backlog needs to be a key priority for the NHS to ensure everyone gets the care that they require. And over the next year, we will continue our role in collecting feedback from everyone in our community and giving them a voice to help share improvements to services. We'll also continue our work to tackle inequalities that exist and work to reduce the barriers you face when accessing care, regardless of whether that's because of where you live, the income, or even your race. We will continue to provide Lincolnshire people with the opportunity to have their say on health and social care. We'll continue to conduct enter and view visits across the county and provide outreach and information and signposting. We will look to increase our volunteer community engagement and build on the strong relationships with service providers and commissioners and encourage them to listen and involve their users as much as they can. We'll also continue to share the local voices nationally through Healthwatch England. Thank you. Your voice counts, and with you, we can make a difference. That was a quick overview of our year. Please do check out the full annual report on our website.